And our Digging Deeper special into the state of mental health takes a look outside of Rockford. The last 2 days showed that our bigger cities have a lot to fix when it comes to mental health, but as you move out to our rural communities, things get even worse for people who need mental health treatment. When you get outside of bigger cities like Rockford, needs like mental health care take a back seat to everyday services.
That's not just mental health related. If people can't get their basic needs met, mental health treatment is going to be off the board for them until we're able to, get transportation, food on our table, basic physical health care.
Rosecrans in particular says that thin layer of established health care makes it hard for them to even start planting roots for mental health care.
Problem in some of the rural areas is that there's not even a necessary provider for medical services, because at times that can be something that somebody could tap into with regards to some medication needs or medication management, but we're also seeing a decline in those services in rural areas as well.
More and more, there's a push for mental health providers like Rosecrans to have workers with certification to prescribe certain medications. But as we've covered already, there's a major worker shortage in the mental health field in big cities, which only gets worse as you go out to those rural areas.
In the city of Chicago, I was recently at a conference where they said that they are at 50% staff for behavioral health. And in the rural areas, it's even less than that. So there is not enough people working in the field or trying to help those in the rural areas.
One way Rosecrans has tried to fix the problem is through telehealth, offering whatever services they can from a distance.
Because we have the ability to serve from anywhere in the state of Illinois to anybody in the state of Illinois. But again, that can be a barrier for some as well.
That barrier goes back to everyday service and some families who might lack reliable phone and internet service. But when people are in crisis, Rosecrans casts a wide net to 19 counties to give life-saving care at the scene.
Historically, we have entered into some of the rural counties in that mobile crisis response, and that gets us into the county. It gets us to really save lives, deliver services right there on the spot, and then be able to make linkages to other providers.
Even though Rosecrans has set up services in rural areas like Stephenson County, if you need things like residential care, you won't have much luck unless you're ready to drive.
So the first one is going to be transportation to the closest one that will take your insurance or state-funded insurance. That would be the biggest barrier. Many of them have hospitals or emergency rooms, but if you're looking for a residential substance use program, it is finding one that is where your family could also be involved.
Showing access in rural areas has an even further way to go than areas like Rockford. Well, for those of you who live in rural areas who aren't entirely sure what your options are, NAMI of Northern Illinois is a good place to start to find out what services are in your backyard. Now, some of you might ask yourself after the last 4 days of our coverage, you might be asking, what can I do? Well, you might not be able to change insurance policies or hire more workers, but you can get educated. We show you how in the finale of our Digging Deeper series on mental health tomorrow night at 10.